Congress is getting an update from health experts this afternoon on the West African Ebola outbreak and the potential threat to Americans. The Centers for Disease Control has raised its alert level to 1. Now, that is its highest alert, and it signals that the outbreak is now considered a serious long-term health emergency worldwide. The spread of the virus started in March in Guinea, then spread to Liberia, Sierra Leone, and now Nigeria. Airline passengers are now being screened for Ebola symptoms in Lagos, a mega city of 21 million people and a major world travel hub. 5 new cases of Ebola have been reported in Lagos just this week. The World Health Organization reports the West African Ebola outbreak has killed 932 people and infected at least 1,700 others so far. Spain is now reporting the first case in Europe. 2 Americans, Dr. Kent Brantley and Nancy Wrightbull, contracted the Ebola virus while doing volunteer work in Liberia. They are being treated in Atlanta. I'm joined now by Republican Congressman from New Jersey, Chris Smith. He's the chair of the House Subcommittee holding hearings on the Ebola outbreak this afternoon. Thank you, Congressman, for joining me. I really appreciate it.
Thank you very much, Kristen. I appreciate you having me on.
What is the #1 question you want answered today in those hearings that you're going to?
Well, the #1 question is, are we doing enough, both to contain it in Western Africa, in the countries that have been malaffected, and for the victims there, but also what precautions are being taken? We had a scare right next to my congressional office in Freehold, New Jersey, at Central State, where a man was in isolation and was believed that there was a risk that he might have Ebola. And so we got to separate hype and concern as to how it's transmitted and what the risks are there. People coming in from airplanes, in, whether it be Newark International or anywhere else, make sure that there's enough surveillance to ensure that it's not passed on, and we don't go from 1,932 deaths to even more. This is the worst outbreak ever.
I think that's such an important point, separating the hype from what we actually know. As we just reported, there was a case in Europe. People are being screened when they're coming in from these countries like Liberia. Are you satisfied, based on the information that you have right now, that the screening procedures that are in place are sufficient enough, or do you have some concerns?
It's a great question. The reason why I called this emergency hearing of my committee, it's the Africa Global Health, Global Human Rights Committee, was to ask those very questions and to ensure that we have enough personnel, enough of a mobilization. We know WHO, the World Health Organization, is working overtime on this, as is CDC and NIH, but we want to make sure questions are answered, and whether or not there is a need for additional U.S. funding. Is there a policy issue that needs to be addressed? I've been working on what we call neglected tropical diseases for the entirety of my 34 years as a member of Congress. I have a new bill in on that. This infectious disease, while not technically in that grouping, parallels it. These diseases are, as we all know, so incredibly lethal that this could break out. I was in Lagos a number of years ago. It is heavily populated, 21 million plus people. Now we have a situation where there are cases in Nigeria, in Lagos. Other times it's been way out in very rural areas, and it burnt itself out is probably not the right way of putting it, but it ended. But this flare-up, this outbreak, has very serious possibilities of exploding even further.
And Congressman Smith, I just want to get your reaction to something that President Obama said yesterday in the news conference that he held. He said it's too soon to think about fast-tracking some of the experimental medications that we know are helping those 2 Americans who are being treated right now in Atlanta. Do you agree with that assessment? What are the ethics for you behind these experimental medication that's
another
being
great
used?
question, and I watched that press conference. I do believe, and that's some of the questions I'll ask Dr. Friedman, from the head of CDC, when he appears at 2 o'clock at my hearing. I am concerned that ZMapp, which is what has helped apparently Nancy Wrightbull and the doctor from Samaritan's Purse, who has also been affected, Dr. Brantley, they seem to be improving. Now, this has a 50+% fatality rate. Other times it's been as high as 90%. There's also a very promising substance, chemical, out of a firm that was contracted by the Department of Defense in Canada. That has been halted. I will be asking questions as to why it's been halted. Remember, FDA does first safety and then efficacy. When you are faced with the prospects, very high prospects of dying, it seems to me that we need to accelerate efforts. And if people like Dr. Brantley want to take the risk of taking something that is unproven, I think they need that ability to opt in, particularly with such a lethal disease such as Ebola.
All right,
so I would say we need to move that much faster than it's going.
All right. Well, we really appreciate your insights this morning. Congressman Chris Smith, thank you so much.
Thank you, Kristen.